This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. It's Mon Health Talk. I'm Dave Wilson. We'll be talking pain management this morning. Let's welcome in our guests, Dr. Mark LoDico and Dr. Matthew LoDico, a father-son team with Mon Health. Good morning, guys.
Good morning.
Well, thanks for taking some time with us. We will get to know both of you here before we get into today's subject. And can I go with Dr. Mark and Dr. Matthew since it'll get confusing otherwise? Would that work for you guys?
That works. I don't hear Matthew. I don't know that he's on yet. So.
Oh, is it just Mark?
Yes, I think so.
Oh, I'll tell you what. Yeah, we had him, and it appears he's dropped off. We'll get him. So in the meantime, Dr. Mark,
yes.
You'll have to pick up the slack until we get Matthew back on the line, which I'm sure you're used to, right?
Yes.
All right. Hey, just let's start off talking about your background. Just tell us where you're from, education, how you ended up with Mon Health.
Sure. Well, the accent's New York City. I went to school in Syracuse at the medical center there. And we first came to Pittsburgh in 1992 after I finished my residency and fellowship in anesthesiology and in pain management. And we expanded into Morgantown about 6 years ago. And we've enjoyed the local community. Treating patients there has been very satisfying for us.
How did you end up specializing with pain management?
Pain management in the late 80s and early 90s focused on reaching nerves and different structures through the use of non-surgical means, such as injections and devices that could be passed through the skin. And anesthesiologists were particularly adept at localizing the nerves because we do regional blocks and that sort of thing for surgery. So it became an option, and I particularly liked dealing with the patients who happen to be awake rather than the typical unconscious or greatly sedated patients we work with in the operating room. So dealing with people with acute and chronic pain produced a more personal interaction with the patient, and it allowed greater satisfaction for me and other people in pain management.
So why did you end up with Mon Health? What led you to choose Mon Health to come here and set up shop? We wanted to get into the Morgantown area. Mon Health was very open and was in need of our services, and it turned out to be a very good match. It turns out that the patients appreciate being in the Mon Health system, and I can't tell you how different it is from the typical big city patient population, sometimes whose expectations are unreasonable. The people in the greater Morgantown area are reasonable, genuinely interested in getting better, and again, produce a great deal of satisfaction for the doctors as well. Well, September is National Pain Awareness Month, and before the break here, can you give me some insight on why pain management, and you touched on this a little bit already, but why you are passionate about it and why this needs to be brought up and discussed?
Sure. Well, it used to be taught, certainly when I was in medical school in the 80s, that pain was something that everybody should just expect, endure for some brief period after some kind of trauma or injury or after surgery, and that it would pass. And the primary focus in the past was to prevent the patient from becoming physically dependent on pain medications. In fact, they didn't even use the phrase physically dependent. They would say addicted to pain meds.
On the other hand, by the early to mid-90s, we became aware that patients who were undertreated, who had uncontrolled pain and unnecessarily high-intensity pain after injury or surgery, those people actually were more likely to overuse medications and use them into in long term, and then becoming physically dependent. So we realized that being very aggressive treating people with early pain management actually prevented the abuse potential later on. And not to mention, of course, it provides for sooner recovery. People get mobile more quickly. They get to physical therapy. They use their new knees and hips, and after back surgeries, they get back into a more normal functioning, the better their pain is controlled. So it's been a little bit of an uphill battle because many docs and surgeons who have been taught, downplay the pain medicine after surgery and injuries are skeptical that we may be setting the patient up for an abuse situation. But over time, many have learned that the patients are more satisfied. They get off the pain medicine more quickly. They get back to full functioning quickly. And that doesn't mean we don't deal with patients who have addictive personalities, who may sometimes, have to be managed more aggressively and more closely to make sure that they don't become dependent. But we have ways of sorting that out. People who are truly in need of pain medicine get it, and they get certain interventions that we can do. And the people who are preoccupied with either the euphoric effects of the pain medicines or who are abusing the interventions for financial gain or for work situations, those people eventually emerge, and we can sort them out, and then we get them the help that they need as well.
Dr. Mark LoDico is joining us this morning. We're talking about pain management. We got to take a quick break. We're back for more in just a moment. This is Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Dr. Mark LoDico. We're talking about pain management, and September is National Pain Awareness Month. And Dr. LoDico, what are some of the common pain problems that you typically treat?
Probably the most common is low back pain, and secondly, neck pain. We call cervical pain. It's very common, especially for people who are very physical, who have jobs that either require a great deal of lifting or twisting, or for people who actually sit for long periods of time. That's pretty tough on the back. And there are, a large portion of the population, once they're in their 40s and older, who develop some wear and tear in their low back, some degenerative changes in their discs and in their facet joints. And most often they go to their family doc, and the family doc does the typical x-ray to make sure there's no tumor or infection. And then they try physical therapy and things like nonsteroidal anti-inflammatories. And if that fails, they usually send them to either an orthopedic spine surgeon or a neurosurgeon to see if there's some kind of surgical fix. And that's not very common. It's more often than not, I'd say 8 out of 10, 9 out of 10 patients who get evaluated by a surgeon are advised that surgery is not likely to make a difference, or there's no surgery to address their problem. So that's a very large percentage of our practice. There are people who have chronic low back pain. Typical scenario, somebody in their early 40s has low back pain. Occasionally it runs down their leg. And they come to us. They try chiropractic treatment. They try physical therapy. And then when that fails, they come to us to see if there's something we can do. There's actually a pretty large repertoire of procedures that can be done. Typically, you'll hear patients can get epidural steroids, which is particularly good for pain that runs down people's legs or down into the arms. Then there's facet joint injections and rhizotomy, which is altering the nerve supply to these little tiny joints in our necks and our back to take away the chronic pain. And then there are other procedures where we can put stem cells in people's discs to help regrow the disc, or we can take away the nerve supply within the bones of the spine so that even though there's some arthritis there, it doesn't produce any pain, so the patients can go about their lives and function just fine. Typically, people who do develop low back and neck pain have that kind of smoldering background of aching all the time. Sometimes it gets worse, but it's rarely gone. And it never stops them from functioning. They still have full power to their arms and their legs, and they're able to conduct their lives, but always with this background pain. And we usually can make a big difference in the level of that pain with some of these interventions. Now, that's on one end of the spectrum. That's the most typical. A little less likely are the people who have gone and already had surgery, and it worked for a while, and a number of years later, their back starts to hurt again or their neck starts to hurt again, and the surgeons advise there's no additional surgery that can make a difference. And for those people, we can manage them either with medications or implantable devices. We can put little pumps that can go under their skin that delivers pain medicine directly to their spine, so that can take care of their pain. There's also electronic devices such as spinal cord stimulators that can provide coverage. And these are usually reserved for people who've tried and failed most other things. But then the patient is really never without an option. There's always something that can be done and to maintain a good, healthy level of activity without being overwhelmed with pain medicine.
You mentioned a lot of the common types: lower back pain, neck pain. Are there things you can do in your lifestyle or even within your job? Because I can think of a few that would cause some back and neck pain that can help prevent developing pain down the road somewhere.
Yes, actually, probably the greatest risk factor for developing low back and even neck pain is our weight. Maintaining as close to an ideal body weight as possible makes a big difference. If a 30-year-old is walking around with an extra 40 or 50 pounds, they may look fine. And the average male in America at 5'11" is about 220 pounds. That's about 30 pounds or more above what would be an ideal body weight, and that is kind of like walking around with a knapsack, on your back with a 40-pound weight there all the time. That would produce a great deal of wear and tear in both your neck and your lower back. So maintaining as low a weight as possible makes a huge difference. It also helps prevent developing arthritis in the knees and the hips. But low back and neck are most susceptible to increased weight. The other thing is a very sedentary lifestyle. Simply walking at a brisk enough pace where people are swinging their arms, not like a power or speed walker, but just briskly enough so that you're swinging your arms, taking a walk daily of about 20 to 30 minutes can make a huge difference in preventing developing the low back and neck pain.
Dr. Mark LoDico is our guest this morning. We're talking about pain management. We'll be right back to wrap up the conversation as we continue on Mon Health Talk this morning on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guest this morning, Dr. Mark LoDico. We're talking about pain management today, and September is National Pain Awareness Month. What is your specialty in pain management, something in that specialty that you want people to know, but they might not necessarily be aware of or even think about?
That's a good question. It's my experience. I've been doing this 35 years. That often people have tried some pain interventions, such as an epidural steroid or facet rhizotomies, and they've had minimal effect, or it was only temporary. And some of those people conclude that there's really nothing more that can be done. And I would say on a regular basis, we meet people who have that kind of experience who then come to us and find that they still respond to some of those very same procedures because the procedure is dependent upon who's doing it and the approach that they take. There's more than one way to skin a cat, and there's more than one way to do an epidural steroid, or more than one way to do a facet rhizotomy, or more than one way to do a discogram or an intracept procedure. There's many procedures that are very dependent upon who does it, how conscientious they are about doing a complete and thorough job. So if somebody's already been to a pain management practice and they either had minimal or only temporary relief, it's still worth exploring with another practitioner, and we're always happy to address this very same issues.
How often have you had that conversation where a patient will come back to you later after you guys have developed a treatment of some sort and say, I didn't think there was anything else that could be done, but now you could finish I'm back to doing this, or I'm able to do that. How often do you have those conversations?
Every day. Not everybody is a 100% success, but most people report that because of the treatment plan and because of some of the procedures and medications they've been using, that their pain is better than 50% controlled, or they're walking more comfortably, or they're able to pick up their grandchildren more comfortably, and their satisfaction in life and their experience is of enjoying their daily routines is greatly improved. That's a daily experience. And in fact, it's the minority of patients who have virtually no effect or who are completely unsatisfied. That's actually very rare.
Just have about 40 seconds here. How can folks make an appointment with you? Will they get a referral from their primary care physician? How will they see you?
Right. Most people would get a referral from their primary care, but they can call us directly. They could reach us through the Mon General Hospital, or they also can get us through our main number at 724-933-0300, and that's even for the Morgantown area. And if they don't have the referral from their doc, we'll actually get it for them, but we'll set an appointment up for them and take care of all the paperwork that is required for their insurance and for their docs to get all the records that we would produce, so their family doc would be in on it.
Dr. Mark LoDico, pain management doc, appreciate you stopping by this morning. Enjoyed the conversation.
My pleasure. Thank you very much.